and say, Randy, what is going on with my health? Look at this infection on my arm.
Okay.
But it hides under the gums. People don't know it. They don't take it as a real health risk, so it's ignored. But there would be under no circumstances, if it were in any other part of the body, would anyone ignore it.
So get it diagnosed first.
Get it
you can
diagnosed.
Go to your general dentist.
You can go to
And
your
what do you
general
say?
dentist.
Give me a gum check.
Yeah,
You
check
call them pockets.
pocket. Yeah, we want to do pocket probing depth, and that is 6 points around the tooth to check the health of the gums. And certainly your general dentist can do that, but we advocate, particularly our adult patients, to come see a periodontist because, again, we are specialists in adult dentistry, diagnosis, treatment of gum disease, which is extremely prevalent in the adult population. As I said, 75% of people walking around today have some form of gum disease. It's the leading cause of tooth loss.
It's also about saving your teeth.
It's about saving your teeth. It becomes with one tooth. It starts with one tooth, and then it becomes 2 teeth, then 3 teeth, then 4 teeth, and then, your teeth shift. It's this big cataclysmic event.
Now, on the phone you said, Randy, that these people, in some cases, we give them their life back.
Yeah, we do. We really do. Because
how? Really? I laugh because it sounds like an exaggeration.
It really provides an opportunity for a lot of people to regain their health. Okay? Because it's an impetus. They may not have heart disease or diabetes or other issues, but they have gum disease because it's so prevalent. Once they take the initial step to treat the infection and remove the infection, right, they now have taken the first step towards controlling their own health. And they begin many times to, stop smoking.
Really?
Yeah. To eat healthier, to take vitamins, to do things that, again, almost to lose weight, whatever it is. When they commit to their oral health, they really commit to their overall health.
So what about the people that are really bad off? Their mouth's a mess.
Yeah, their mouths are a mess.
Does it become too late?
It's, they come in and they're even embarrassed for me to look in their mouths.
You said that.
Yeah.
Interesting.
Have you ever seen a mouth this bad, doctor?
Do they say that?
Yeah. And that's what we do every day. And we're here to help our patients. So we don't judge. But what we do want to do is facilitate, first and foremost, removing the infection. And again, as I said, today with the laser, Randy, we can do it in one visit.
But then
no cutting,
so you got
no
rid
pain.
of it, but they want a beautiful smile. Now what?
Right. So
do you do
then
that part of it too?
We'll develop a treatment plan if they need to replace missing teeth with dental implants. If we can't save their teeth, we can convert them to teeth in a day with dental implants. And we often will work with their restoring dentists or cosmetic dentists to provide either veneers, caps, crowns, or bridges when needed. So we're
when I hear
really
people that say I have bad gums. Okay, so I can't get veneers or whatever.
That's right.
People ask me because of the show, they email me in. So you're saying that this is periodontal disease, it's a gum disease, that if they catch it early, because they lose teeth,
they can have all of the dentistry done that they need. But
then they could get.
Then they can have the caps and crowns and everything else. But it's like this. It's like building a house. So you got to build the foundation first. So that's why periodontics, or treating periodontal disease, is the most critical component of your dental health. Okay,
so this laser has made it fun for you.
It really has made it fun. And I
in
think
the old days, it was a big drag, right?
Yeah.
Doing gum disease, scraping.
It was.
Because you were hurting the patient.
Well, you knew the
I don't
patient was going to be uncomfortable. It was very difficult surgically to provide, that procedure. It took a lot of energy from the practitioner. But, I talked to my colleagues throughout the world that are utilizing the laser procedure to treat gum disease. And, everyone is just astounded as to the patient response and the clinical results. So the people are just really raving about this technology.
Okay.
And but again, it works, without a doubt. But the bottom line is this. It all comes back to diagnosis. Get diagnosed early, come in early, have a diagnosis, and treat early.
You say there's a psychology of tooth loss. That people, it makes them feel older.
It really
they tell you
does.
this on the consult?
Yeah, tooth loss is debilitating. Not only the ramifications of it, the bone loss, the hollowing of the jaws, the resorptive process, but when we restore smiles, people can chew with confidence. They can go out, they can smile.
So I understand this correctly. Okay, so if you have gum disease, your teeth may be a little wobbly.
Sure, they're wobbly, they're sore. People can't eat comfortably.
But that's stopped. I mean, help me understand. So you do this treatment on the ideal candidate, whatever the candidate might be.
Right.
Stop the infection. How do the teeth, I mean, once they're loose, isn't it too late at that point, though?
No, because what's amazing is that the light provides an opportunity for
the laser light.
The laser light provides a stimulatory effect on the cells of the human body, in particular the cells of the oral cavity. This particular laser has been designed only for periodontal disease treatment. So it stimulates the cells and the attachment around the teeth to heal itself, actually healing the gum, the bone, and the tissues that hold teeth in. So people can, eat comfortably, go out and eat a steak. They don't have bad breath. They can kiss their spouse. So they're really able to live their lives, in particular, as they age. I mean, there's nothing worse than not having your own teeth. And anyone who says they're comfortable wearing dentures is absolutely just adjusted to them.
Okay.
Because there's no way you can be comfortable eating mush.
Okay, so it started somewhere.
It started somewhere.
So if you got these people early enough,
absolutely.
This is your opinion.
Yeah.
Early on in this process, with the laser, you probably could have stopped it.
Right.
And of course, if they followed your protocols.
That's right. If they're diagnosed and treated early. And that's a critical component. So by seeing a periodontist, Randy, we're able to diagnose them and then provide them with a variety of treatment options, because it's not only about treating the infection, it's also about restoring. Oftentimes, I may have to take out teeth at the time that we do the laser gum treatment. We may have to build up the bone to replace teeth with dental implants. So by seeing a specialist, we're able to provide a variety of different procedures to restore your oral health.
So general
at
dentists
one visit.
Is this laser in the hands of general dentists also?
Yes.
Okay.
Yes.
So you probably have a bias. You think that they should see a periodontist.
Yeah.
I mean, what's the advantage?
Yeah, we're specifically.
Does the machine do all the work?
No, certainly. It's about diagnosis. Okay. It's technique sensitive, and because it requires a knowledge of occlusion, of bone, of the overall oral condition, certainly it is more advantageous to see your periodontist. Because again, as I said, we're going to be able to provide other treatments such as implants, extractions, reparative procedures on the gum, on the bone, to, again, build the foundation for beautiful teeth. Because at the end of the day, we're not talking about anything but providing people the opportunity to live a healthier life.
To get their smile back.
Yeah, get their smile back, have their teeth, chew with function, and have it done in a very, very simple, painless way, in a non-threatening way, so that they leave back in control of their life.
So it doesn't really hurt that much. I mean, it's not something they complain about, I should say.
No, I have.
Is that true?
That is absolutely correct. We don't have nearly the complaints post-operatively, as I said earlier, that we had. Patients are taking maybe some Advil here and there, but the real important part is that they now are able to feel more comfortable knowing that this infection is removed.
I always get this from the doctors. They'll say that people that, whether it's a heart surgeon, an orthopedic guy, that the specialist will watch, the same type of other orthopedic surgeons will watch their show. So the same thing will happen with you. Dentists will watch this show. And dentists will watch the show that are very skeptical, because I've talked to them about this laser for gum disease. What do you want them to know about this laser in your community?
Yeah,
the other dentists.
I think it's absolutely something worth looking at for the general dentist to provide this level of care. Again, I work with a variety, 65 general dentists in the state of Pennsylvania, and my goal is to be able to provide them with unbiased information and educate them. Because let's face it, what I really do is provide education and support for my patients.
It works.
It works. Absolutely.
That's the main point here.
Yeah, it absolutely works.
So if we back up 10 years ago, okay, with you, periodontist, you were doing the for gum disease. You were this root planing, scraping, surgery.
Pulling the gums away from the teeth.
And there's still guys doing that even today.
Sure. And
what about now? How often do you do that procedure for gum disease?
I don't do it at all, because if I give
really
a patient the option of traditional surgery versus having the opportunity to utilize a minimally invasive technique such as the laser, everyone chooses to have the laser for good reasons, because they don't want to have their gums pulled away from the teeth and cut. They don't want to have them sutured. They want to have a minimally invasive technique. And look, let's face it, most of the surgical techniques in all aspects of medicine and dentistry are going minimally invasive. So the laser really is the future. It's the future for the
But this laser is a little bit different.
It is different.
It's the only one FDA approved
for the
periodontitis.
That's right,
Is that right?
for periodontitis.
Because in San Diego, we talked on the phone, by the way. You made me on the phone feel like maybe I had it. Couldn't really find a doctor out here with one of these lasers, one of the Perilace lasers.
Right. There are other lasers that have been marketed to treat gum infection, but there is no other laser that is FDA approved.
In your town, let me understand this. Put this in perspective. In your town, would you say more than 100 of these cutting and stitches procedures are being done a month by other dentists? I mean, is it that common? Not maybe just in the small town, but within a
Sure,
I mean,
absolutely.
it's happening every day.
Every day, every
And
day.
it doesn't have to be.
It doesn't have to be.
Really?
No, absolutely.
Get the
not.
laser. Get it done that way.
Get the laser. Provide a minimally invasive, comfortable single visit protocol. Again,
You can say single visit. You're big on the single visit. You're big on this experience.
Yeah.
Aromatherapy.
yeah,
all this
because
other stuff.
most of the reason that periodontal patients don't come back is because they've had one collagen treated of scraping of the gums, right? 8-10 years ago, right? They will not come back for the next procedure because that's how, not uncomfortable necessarily during the procedure, but afterwards. It's just not a happy procedure.
So of all areas of dentistry, the treatment of gum disease was pretty much the most painful?
Pretty much
in a way?
the most uncomfortable.
Uncomfortable, I should
yeah,
say, after the procedure.
Exactly. And patients developed a real fear of having any other treatment done.
Great stuff. Final message. Somebody watching this, maybe they're skeptical or maybe they fit into the category of gum disease. What do you say to them?
Call your general dentist. Call us directly. For the people that know they have gum disease, take care of it now.
Call you now. Get in there tomorrow.
Get in there because you're going to save yourself a lot of health-related issues. You are going to save yourself a lot of time and, of course, a lot of expense because dental management is an investment.
Okay.
Let's face it. So all aspects are easier the earlier we diagnose and the earlier we treat. We won't have to do a mouthful of implants and complex restorative
If you
dentistry.
catch it early.
Yeah.
Okay, good.
Catch it early.
Well, thank you for coming on the show. Very interesting.
Thank you,
Good
Randy.
Stuff. Good stuff.
Really
You're
enjoyed
watching
it.
The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website. Or if you want to point a friend that may have gum disease, friend of yours or a loved one, go to wellnesshour.com. You can just punch in gum disease and you can see it all over again. So for now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues. Designs for Health is the nutritional supplement brand of choice, exclusively recommended by healthcare professionals.
As a physician, I insist on the science-first approach of Designs for Health. They have synergistic formulations with optimum quantities of therapeutic nutrients.
Designs for Health, the leader in professional brand nutritional supplements.